we talked about longevity, we talked about dogs, we talked about neuroscience and all this stuff. But then generally, all this is underneath the umbrella of healthcare. All of this is kind of under health
Yeah.
and whatever that means. And so like you've had kind of dealings with socialized healthcare in other places, but then also you in the United States here with our healthcare system. And I don't know if you've seen that famous graph, but from the 70s of like the amount of administrators versus physicians, the
Yeah.
uptick. And so it's just like that. I don't know if that plays into with some of these things, but then or economic incentivization. So let's just kind of talk about the healthcare industry in general, like good, bad, sad, and then also in specifically into preventative and curative medicine, because one of the flashpoints of you starting all of this is how your good friend John passed away, and then you wrote about that. And so let's just talk about preventative and curative medicine, and then how that might not be available really here in the United States, and then other places that might be available, and then the healthcare in general.
Yeah. So I guess like for context, I like didn't grow up with a lot of money. My mom didn't have health insurance for a really long time, and I had some health issues that caused me to have insanely large medical bills. That honestly, my credit score like is still hampered by them today.
Pump
Which makes
it up, Celine.
Renting in SF like a little bit difficult sometimes. I mean, thankfully I've like been financially fortunate now. I'm able to pay it all off. But it was really like scarring. Like I remember as a kid, being sick and then telling my dad not to bring me to the ER because I knew it was going to cost him thousands of dollars, despite the fact we had health insurance.
Sure.
And so I think that's like one reason I've always been very interested in healthcare. And then the other reason, and the thing I was like studying at my PhD is, I mean, in my view, aging drugs are the ultimate just preventive medicine. Honestly, I don't think it's actually that sexy at all. We're kind of just like a vaccine of a different modality in some ways.
Right.
But it's actually difficult because and this is a gross simplification, but in general, like preventive medicine isn't actually like super economically incentivized in our current structure. In terms of like the multi-payer system we have in the US, right? Because the catch-all is like the US government in terms of like when you're 65 and up. And then before that, you're on private. And on average, people switch private insurance approximately every 2 years. So if you think about it, like if you're taking a preventative medicine that like won't have an impact for, a couple decades, you're just saving the government money or saving your competitor money. You're not saving yourself money. You're having to pay for it.
Wow.
And also I think just like culturally, react, like people have a high willingness to, like you'll pay $500,000 for a cancer drug that gives another 2 months, but you won't pay like much of anything for a preventative thing. And like vaccines are a good example of this. Like the willingness to pay the vaccine, it's the severity of a disease times like your perceived probability of getting that disease in your lifetime, right? So like the willingness to pay for like a shingles vax or whatever is like quite low. Like vaccines like before COVID basically don't make that much money because you're like curing your population in many ways.
Right.
And
that goes directly against a lot of the social medicine in general because it's very preventative, or not preventative, but very reactive. Sorry, rather than
very
proactive.
Reactive.
Yeah.
And it's the same thing with like in sort of a different thing in like single payers. I went to Sweden because I was interested in single payers. Also why I did my PhD at Oxford, as I was interested in the NHS. And they each have their own flaws. One thing is like challenge paying for things, but they're really good at preventative medicine because they're economically incentivized. It and incentives are aligned, right? Like the NHS pays for you at birth, and it pays for you when you're 50. But it doesn't have that much money to pay for you. So you're not going to get access necessarily to all the same drugs that you might do if you're in America. And the late life drug that you're definitely really going to want if like you have terminal cancer, even if it's uneconomically advisable, you're still going to want it and you're not going to get it. Right.
Right.
Because it won't because it's not ICER, but whatever the equivalent in the UK is, like won't justify like the quality willingness to pay. So yeah, I mean, that's the kind of other problem I want to work on, like post loyal. If there is a post loyal is
when you're retired, you're gonna get into politics and all this other stuff.
When I'm the chairman or whatever, chairwoman, is actually healthcare, because that's a problem that you like very briefly tried to work on this, but like that's a problem that you really can only tackle when you have a lot of money.